Welcome to the Edelheit Experience, a compelling conversation about revolutionizing health and well-being, bringing you rich stories and lessons learned from leading corporate executives. Now, we'd like to introduce your host, Jonathan Edelheit.
Welcome to the Edelheit Experience. This is Jonathan Edelheit, and I have Jessica with me. Jessica, thank you for joining us.
Thanks for having me today.
Jessica, maybe you can give to our listeners a little background on who you are and what you do.
My name is Jessica Lee. I'm the CEO of Tria Health. I'm a pharmacist by training. Obviously spent my background in education and learning how to incorporate the role of the pharmacist in the healthcare team. Got my education and background in developing those types of situations where pharmacists were working directly with patients and physicians. That naturally led me into the role of the CEO of Tria Health. And my passion really is about ensuring that individuals who have chronic conditions and multiple medications have the opportunity to work directly with pharmacists to help improve their understanding of their disease states and their medications and improve their outcomes, hopefully improving and causing healthier lives for those individuals. And there's a lot of other great things that come along with that improvement in outcomes.
Mm-hmm. And at the end of the day, I feel like a lot of people don't talk about the pharmacist or their role in this, or don't even think about it. And our organization, Healthcare Revolution, we had launched 3 moonshots around cost, care, and culture. So it would be great to hear your perspective on how does a pharmacist impact these areas?
Sure. I think cost, let's start with cost, because I think a lot of times it's easy in the current healthcare environment to say a pharmacist can impact cost by helping to ensure that you're helping the patient navigate their benefits to choose the most cost-effective medication. I think the challenge with cost as it relates to pharmacists and pharmacy is that not only are you helping the individual choose the right medication that is the most cost-effective, but you have to choose the right medication that actually produces the outcome you intend. So, for example, if you have a person who has high blood pressure, at the end of the day, even if you're taking the cheapest medication, but you're not getting the blood pressure lowering to reduce risk of stroke and heart attack, then that's the most expensive medication you have. So I think pharmacists have the ability and cost to be able to not only help choose the most cost-effective medication, but also ensure that that medication is driving the outcomes by working with that patient and that physician to achieve the goals of therapy with their medications.
But in what you're saying, I think a lot of people listening to this would be like, they're just hearing the word pharmacist, right? And they might even be thinking, listen, I go to the supermarket, I go to my drugstore, my doctor's prescribed something, the pharmacist fills it, I get it, that's it. My doctor kind of has my back. What's the gap that's there, and what's the difference between clinical pharmacists like that you are and just the normal pharmacist?
Yeah, I think the pharmacist that you interact with when you're picking up your medication is just on the cusp of giving you what a pharmacist really has the capabilities to do. And when you're going to the supermarket or a chain store, really they're unfortunately focused just on ensuring that the right medication gets in the bottle, which gets to you. And that's a huge component of it. But at the end of the day, what we as pharmacists train, multiple years for is really about ensuring that regardless of the disease state that you have been inflicted with or the symptoms that you're having, our job as a pharmacist is to work to find the best therapy to make your quality of life better as it relates to those disease states. So, there's millions of medications, and we're getting more and more medications out on the market these days. And pharmacists are really spending their time being experts in helping to drive the best outcomes because they understand how those medications work. And then my job is also to explain to you how they work so that you have a better understanding of why you're doing what you're doing with your medication. So I think it's an extensive level of education and understanding that allows us to complement the physician who is doing the diagnostic work, identifying the challenges of why you're having a symptom or what disease state you have. The pharmacist is there to drive the medication usage and the outcomes and ensure that it's safe and effective.
And when you talk about chronic conditions or diseases, is what percentage of adults have that? How many prescriptions are they on? And like, what's do you have a totally different approach in how you handle those cases than how they're being dealt with when they just go to their local pharmacy and just get whatever the doctor ordered?
Sure. Well, we believe there's some statistics out there that say that 30% of adults in America right now are taking 5 or more medications, which doesn't even include some of the over-the-counter things that people take. So, like your medications for allergies or even supplements, vitamins and minerals. When we work with patients here at Tria Health, we're working with patients who are on 10 plus medications. And what I think is the challenge of just taking exactly what your doctor told you, which obviously there's a component of that that's important, but I think having a second set of eyes that's an expert related to medications allows for sometimes deprescribing of medications, because what we're seeing is that, physicians only have about 49 seconds in their visit to talk about medications with an individual. And what happens during that small 15-minute visit too is that you may get prescribed a medication for a side effect that you're having from another medication, or you may be actually not taking the medication as you're supposed to. And what ends up inadvertently happening is more medications get piled on. So sometimes it's just a true challenge of really understanding the journey of where you got there. And, physicians are really forced to spend most of their time doing the diagnostic work, and they don't have the time and the expertise to be able to lend towards teaching people how it is that medications work and how the interactions may lead to side effects. And at the end of the day, it's really about always maximizing what you're taking for your disease states. And that's kind of how we get to 10 plus medications, which is very complicated for individuals for sure.
I can imagine, especially when you need a prescription for your prescription, right? Manage the side effects. It's like, how overwhelming is this for the patient, or how does the patient, is it just, in the current way it's handled, they're given 10 medications and they just deal with it. And, is it stressful? It's, how do they take back control?
Yeah, I think the challenge for most people who are on that complex of a regimen is that, one, they have multiple disease states that they're trying to navigate and understand. And a lot of times, especially when you get a new diagnosis, you're overwhelmed with just understanding that you have a new diagnosis, whether it be, high blood pressure, or you've had a cardiac event, had a heart attack. I think the overwhelming nature of just, what does this mean for me, and where do I go in terms of where my beliefs and my attitude regarding medications and treating disease states, you come into that perspective. It's very stressful. And then I think what happens is, as you get to that 5, 6, 7, 8 numbers of medications, sometimes it's like, which parts are doing what's actually achieving the outcomes. And a lot of times, complicated medical regimens will actually cause individuals to, choose to not take one medication, either because they can't afford it or because they had a side effect to it. And that may be the most critical piece to their medication regimen. So, I think pharmacists have the capability to sort of walk through step by step and give patients the opportunity to understand their disease states, what medications tie to those disease states, and what do they need to do both pharmacologically and non-pharmacologically to get the best outcomes so that their chronic disease is under control and that they have a better quality of life.
Now, when you say that pharmacists can do that, like, what percentage of the time does that actually happen in today's world?
Yeah, I think it's a small percentage. And I think as we continue to move towards sort of a change in the healthcare landscape, a push towards more of a value-based sort of world where we're looking at quality over fee-for-service, I think there's going to be more and more opportunity for pharmacists to be integrated into the system. But right now, you're only seeing those types of services happen if you're working in a closed healthcare system, which we have a few models of across the country. But beyond that, it's the opportunity in this instance for employers to have the resource of this depth of clinical pharmacy knowledge to provide that resource to individuals, because our system is not set up for our retail pharmacists to provide that level of education, and we need to be able to isolate the conversations away from the dispensing component, because this takes time, 45 minutes, 30 minutes sometimes to walk through a regimen that has 10 plus medications.
When you were referring to earlier that employers are just focused on cost and getting prescriptions, medication at a lower price, how does that end up hurting them in the long run?
We see this illustrated sort of uniquely when we work with some of our self-insured employers, and they have what many of us are aware of as a high deductible health plan where there's a large deductible in the first quarter. We see patients foregoing taking their critical diabetes medications that were actually controlling their blood sugars because they can't afford that particular medication during the deductible time frame. And we're helping to try to navigate those patients and choosing a medication that they can afford. And you can imagine the perfect medication, which gives you the best outcome, costing so much that you have to choose between that or maybe paying your rent or your light bill or whatever it may be, the food bill that month. But also recognizing that you may go 2 steps backwards on controlling your diabetes. And so cost comes into play every time almost for individuals. And as we continue to see the cost of medications grow, the cost share for members grow, because it's becoming hard for employers to even handle some of the growth in the costs related to insurance. I think that pharmacists are well equipped to begin to have those conversations so that we can help them navigate not only their benefits, but their cost related to their benefits, and hopefully someday help to give that expertise experience to the employers as well, so they can see that sometimes the lowest costing med actually may make your plan worse off because their blood sugars are no longer controlled, and now they're in the hospital, and now they've got a bigger component to be worried about. So it's kind of a good perspective on it.
So if I was an organization, what questions should I be asking to see if I have in place like what you do, versus, just thinking I've got it covered?
Yeah, I think the first question is, do you have enough pharmacists to provide a ongoing engagement experience with my members who have chronic disease? So, there's a lot of difference in identifying a problem in a medication regimen by running, some type of a software system which says this person here is got a problem with a drug-drug interaction, versus creating a relationship with a member who has a chronic condition and multiple medications. And over the journey of healthcare, over time, we're talking, months and years, helping that individual to gain more knowledge, tie in how they feel about medications and how they feel about their disease states, and continue to reach the why for them, which then allows them to be the better steward of their healthcare. So they're asking the right questions when they go to the doctor. So I think for an employer, understanding the depth of the service that they have, whether that those pharmacists are available for a long-term longitudinal relationship with these patients, but also that these pharmacists have the time to focus only on that conversation with the patient rather than being distracted by other things like dispensing. Those are some key components to it that I think will help to begin to unravel whether or not you're truly getting the level of expertise that's needed to help drive the best outcomes.
Interestingly, I had a relative who a couple of weeks ago, they're older, but was admitted to the hospital for like a week in the ICU. And the medication, my wife looked up the medication that she was given by her doctor, and she's on multiple medications. And one of the medications, 25% of the patients, it causes the condition that put this family member in the hospital for a week. So what you're saying really hits home with me because, my gut is that, she was admitted to the ICU and was into the hospital and could have died because she was on a bunch of medications and the doctor really wasn't managing it well. And it's scary out there. I feel like like almost every family needs a clinical pharmacist they can call to, check on a relative who's on multiple medications. I definitely, think that this is an area that I think a lot of people just overlook and just think the doctor or the local pharmacist has them covered.
Well, that comment right there regarding like this whole concept of a drug-induced disease is interesting that you bring that up because I think people don't always see medications as cures, and the reality is that a lot of times there are some instances where someone's having an event like your relative who really may have had a medication-induced disease state, and the expertise related to that stuff is hard for physicians to know because they're spending their time trying to diagnose it. So the interesting other thing is that the impact of this day and age and the ability to achieve looking up whatever you want, because in the palm of your hand, you have this phone that will give you the internet in a moment, also kind of complicates it too, because I think people are using that knowledge that they're finding and it may or may not be valuable. So having a relationship with somebody who's an expert in that arena and being able to create some trust and loyalty there allows for I think people to navigate this crazy healthcare system more easily.
Any closing words of wisdom as we wrap things up?
I think my biggest probably piece of advice or wisdom is that as we continue to become a more complicated healthcare system with more challenges, it's really important to provide resources to these individuals who have complications and confusing, challenging problems with multiple medications and multiple chronic conditions. And being able to have a resource like a physician and like an expert in the medications is key to helping these individuals get better. And I think a key component to driving healthcare costs down.
Mm-hmm. I think that's great. And I think also, we need to understand it's not just about cost. Cost is important, but, not dealing with something like this in the end has a high likelihood of costing someone more. And then also the human factor of, what the final outcome is for the quality of life of the actual patient themselves.
For sure. Definitely.
Great. Well, thank you for joining us, Jessica.
Thank you. I appreciate it.